Welcome to study session 10, Pelvic Assessment and Vaginal Examination. Introduction. The assessment of the pelvis is the process by which the adequacy of the pelvis for the passage of the fetus is ascertained internally. In this study session, you will learn about the aims of pelvic assessment during pregnancy and the preparation of the client before this procedure. You will also be learning about the indications for vaginal examination, but the class will explain in detail vaginal examination in labor. Also, it will discuss the objectives and requisites and equipment for vaginal examination. The study session will conclude with a description of the procedure for pelvic assessment and the detailed procedure for vaginal examination. When you have studied this session, you should be able to 1. Discuss the concept of pelvic assessment. 2. Discuss the concept of vaginal examination. The meaning and the policy guiding pelvic assessment. Definition. Pelvic assessment, pelvimetry, can be defined as a process by which the adequacy of the pelvis for the passage of the fetus is ascertained internally. Policy. Pelvic assessment should be performed by an obstetrician or experienced midwife or a midwife who had undergone training on life-saving skill at 36 weeks of pregnancy or during labor. The specific objectives for pelvic assessment. 1. The specific objectives for pelvic assessment are to know the size and shape of the pelvis, to detect a misfit between the fetal head and maternal pelvis. Indications for pelvimetry. The following are indications for pelvimetry. All gravidas towards the end of pregnancy. Patients who have had prolonged or difficult labors for no apparent reason. Vaginal birth after a previous cesarean section. Equipment and requisites. Tray or trolley. 1 bowl with antiseptic lotion. 1 bowl with sterile cotton wool swabs and perineal pads. 1 galley pot with antiseptic cream, e.g. Hibitane cream. 3 sterile dressing towels. 1 pair of sterile gloves. 1 kidney dish with sterile urethral catheter for making bedpan available. 1 kidney dish for dirty swabs. Macintosh to protect the bed. Preparation for client. Explain the procedure, indications, what you may feel like, and possible discomfort to the woman. This will prepare her psychologically for the procedure. Ask your client to empty her bladder. This will facilitate comfort. Position the woman in a dorsal position with her thighs flexed and abducted. Instruct her to put the heels of her feet together. Drape the woman with a modesty sheet, leaving a flap to access the perineum. The position provides access to the perineum and the drape ensures privacy. Encourage her to relax her muscles and legs, as relaxation decreases muscle tension and provide comfort. Procedure. Step. Put on face mask, scrub hands under running water, dry and put on sterile gloves. Maintain asepsis. Swab the vulva. Maintain asepsis. Lubricate your index and middle fingers of your right hand if you are a right-handed person and vice versa. Lubrication provides easy insertion of fingers. Insert your index and middle fingers into the vagina in an upward and backward direction. Assess the condition of the vagina, the cervix, and the uterus. Assess the following pelvic diameters as follows. Pelvic inlet. Palpation of the pelvic brim. The index and middle fingers are moved along the pelvic brim. Note whether it is round or angulate. Diagonal conjugate. Try to palpate the sacral promontory to measure the diagonal conjugate. Normally, it is 12.5 cm and cannot be reached. If it is felt, the pelvis is considered contracted and the obstetric conjugate can be calculated by subtracting 1.5 cm from the diagonal conjugate. This assessment is not done if the head is engaged. If you are not sure about the measurement of your fingers, measure the distance from the top of the middle from the top of your middle finger to where the lower part of the symphysis pubis touch the index finger with a tape or ruler. The mid-cavity, shape and inclination of the sacrum, side walls, to determine whether it is straight, convergent or divergent. Ischial spines, whether it is blunt, difficult to identify at all, prominent, easily felt but not large, or very prominent, large. The ischial spines can be located by following the sacrospinous ligament to its lateral end. Interspinous diameter. By using the two examining fingers, if both spines can be touched simultaneously, the interspinous diameter is 9.5 cm, that is, inadequate for an average-sized baby. Sacrosciatic notch. If the sacropinous ligament is 2.5 fingers, the sacrosciatic notch is considered adequate. Pelvic outlet. Subpubic angle. Normally it is 90 degrees. Bituberous diameter. Normally it admits the closed fist of the hand. Foreknuckle. Mobility of the coccyx. By pressing firmly on it while an external hand on it can determine its mobility. Anteroposterior diameter of the outlet, from the tip of the sacrum to the inferior edge of the symphysis. Method: clean your client up. Makes your client comfortable. Step 2. Record your findings on the vulva, vagina, cervix, uterus, pelvic inlet, mid-cavity and the pelvic outlet, such as obstetric conjugate, prominence of the ischial spines, the curve of the sacrum, prominence of the sacral promontory, the bituberous diameter, the angle of the pubic arc, and the anteroposterior diameter of the pelvic outlet. It allows for planning further care. The meaning and objectives of vaginal examination. Vaginal examination can be defined as a digital exploration of the vagina to assess factors of pregnancy, labor, perioperium, and gynecological conditions. Objectives. The objectives of vaginal examination include to assess status of the pelvis, to identify abnormalities, to assess the progress of labor, to assess pelvic capacity in relation to the fetal head, in order to plan adequately for the appropriate mode of delivery. Indications for vaginal examination. Vaginal examination has been indicated in pregnancy, labor, puerperium, gynecological conditions, and in family planning. You should note that a midwife is allowed to conduct vaginal examination in labor, puerperium, and family planning. Hence, this class will focus on vaginal examination in labor. Therefore, indications for vaginal examination in labor include to make a positive diagnosis of labor, to make a positive identification of fetal presentation, to confirm rupture of membranes, to rule out cord prolapse, to assess progress or delay in labor, to assess cervical dilatation and effacement. Equipment and requisites for vaginal examination. You should arrange the following on a clean tray: 1 bowl with antiseptic lotion, 1 bowl with sterile cotton wool swabs and perineal pads, 1 gallipot with antiseptic cream, 1 pair of sterile gloves, 1 kidney dish for dirty swabs, Macintosh. Preparation of client. Explain the procedure, indications, what you may feel like and possible discomforts to the woman. This will prepare her psychologically for the procedure. Ask your client to empty her bladder. This will facilitate comfort. Position the woman in a dorsal position with her thighs flexed and abducted. Instruct her to put the heels of her feet together. Drape the woman with a modesty sheet, leaving a flap to access the perineum. The position provides access to the perineum and the drape ensures privacy. Encourage her to relax her muscles and legs, as relaxation decreases muscle tension and provide comfort. Procedure. Put on face mask, scrub hands under running water, dry and put on sterile gloves, maintain asepsis, swab the vulva, maintain asepsis, lubricate your index and middle fingers of your right hand if you are a right-handed person and vice versa. Lubrication provides easy insertion of fingers. Insert your index and middle fingers into the vagina in an upward and backward direction. Identify the conditions of the vulva, vagina, cervix, and membranes. Identify the presenting part, position and station of the presenting part. Feel the consistency and the dilatation of the cervix. Report and record your findings on vulva, vagina, cervix, membranes, and the presenting part. Ensure proper documentation for appropriate care. Clean up your clients. This provides comfort. Documentation. Findings to be recorded on vaginal examination include condition of the vulva, that is, edema, varicose vein, warts or vaginal discharge. Condition of the vagina. This should be normally warm and moist. Condition of the cervix, whether thick or thin, hard or soft, well or loosely applied to the presenting part. Dilatation of the cervical os. Membranes, whether intact or ruptured. If ruptured, the color of the liquid must be noted, either blood-stained, meconium-stained, or clear. Presentation, whether cephalic, vertex, or bridge. Position, whether anterior or posterior. Molding and caput formation. Contraindication for vaginal examination in labor. It is of great importance to you as a midwife to note that vaginal examination is contraindicated in antepartum hemorrhage. Summary for Study Session 10. In Study Session 10, you have learned that pelvic assessment is done at 36 weeks of pregnancy. Pelvic assessment is performed by an obstetrician or an experienced midwife, or a midwife with training in life-saving skill. Pelvic assessment is done to ensure the adequacy of the pelvis in relation to the passage of the fetal presenting part. Preparing your client before the procedure will enhance the cooperation of your client. You can conduct vaginal examination as a midwife, both in labor and during family planning. You need to maintain asepsis while conducting vaginal examination. Vaginal examination is done in labor to assess the progress of labor. Vaginal examination is contraindicated in any form of antepartum hemorrhage. End of Study Session 10. Thanks for listening.